it's Nurse Nikki. Welcome back to my YouTube channel. My last video, I told you guys to comment what you guys wanted me to talk about next. And a lot of you guys wanted me to talk about NCLEX and study tips. So I already uploaded videos on both of those subjects, but obviously I wasn't clear enough, or I didn't give enough information. So I will go back into these two topics for you guys. I'm gonna do both videos separately though, because I feel like I can kind of, give you guys better information if I separate the two so that they're not too long. So first we're gonna do studying tips, because I feel like a lot of you guys are still in nursing school. Also, a lot of these studying tips are gonna be the same for school and for NCLEX. So we'll just do studying tips, and then you guys can apply these tips to, both of your classes in the NCLEX. So as far as studying tips go, when you're studying for class or the NCLEX, you want to find something that works for you. So if you are a picture person, if you learn good with visuals, then you're going to want to go over charts, and you're going to want to look at like videos and stuff to actually help your mindset. Everybody is different. I know personally for me, flashcards were really good. Videos were really good. Also, I said this before, I watched a lot of registered nurse RN videos. She's on YouTube. She's really good. She's an educator. I'm not sure if she's an educator like in real life, but she's an educator on YouTube, and she's awesome. Her videos are very detailed, very informative, and I watched a lot of her videos for different topics. And I am going to show you guys, I'm going to pull up videos that I use in nursing school, because I think you guys need to actually see the stuff. I'm also going to pull up one of my old study guides from my old laptop to kind of show you guys like the template that I use, so you can apply it to your classes now and see if that helps you guys. But really quick before I get into that, flashcards when I was in pharmacology really helped. So we're going to make some flashcards. Hold on. So when I was in pharmacology, I made flashcards. And the flashcards really helped me because, one, I am a visual learner, and also I remember things by repetition. So I like to rewrite stuff. So even if I am in class and I'm paying attention in lecture and taking my notes, which is number one, you want to make sure you're doing that. You want to make sure you're going to lecture and taking notes. So after I do that, after lecture, I'm going to make flashcards. And this is specifically for pharmacology. It works in other classes as well, but this specific study tip is for pharmacology because it works really well here. So after class, I would go and make flashcards. And I would do this right after class while that information is still fresh in my head. So I would make my flashcards based off of my notes and my textbook from that lecture. So it's a repetition thing, because I already wrote this drug and the mechanism and the side effects. I already wrote it down in my notebook, but now I'm going to make flashcards. So it sticks better in my head when I do this. So depending on what type of learner you are, repetition and writing may help you. It helps me. So I made a little fake flashcard. It has real information on it. I call it fake because it's some piece of paper that I just cut up. But don't talk about my flashcards, because I just came up with this idea and I really want to show you guys. So this is how one side is going to look. It's going to have the drug on it, okay? Metoprolol is a blood pressure medication, or you can use it for increased heart rate, but we're going to get to that. So on the back of your flashcard, aka my other sheet of paper, you're going to have this information. So I want you guys to see. So I can't write, but this first line says mechanism of action, and it's a beta blocker. So that's the classification of the drug. Actually, I guess I should have never put mechanism of action, because mechanism of action is actually how the drug works in your body system. So I guess the appropriate word to put here would be like the classification of the drug. So metoprolol is a beta blocker. And if you flip the card back around, you're going to see I put parentheses around LOL, which is the last 3 letters in the word metoprolol, because your beta blockers are going to end in LOL. So if you put parentheses around it, you can kind of remember it. I never forget a beta blocker, because I always remember beta blockers are going to end in LOL. So repetition again, so you don't forget that, okay? So classification is going to be beta blocker. And then treatment. So what is this drug treating? Hypertension, angina, and increased heart rate. And then the last one down here says adverse effects, dizziness, tiredness, and decreased heart rate or bradycardia. So the reason why I put these kind of like categories here is because you want to know the most important information about the drug. This is the most important information about the drug that you don't want to forget. Because in a test, they're going to ask you, for pharmacology, maybe they're going to give you an example of, they're going to say, you know, which drug would you give for, and they're going to give you a blood pressure and a heart rate, right? And it might, I'm just going to throw anything out here. They might give you a blood pressure of 169 over 90 and a heart rate of 50, okay? Are you going to give a beta blocker for those vital signs? Probably not, right? Because a beta blocker is going to decrease heart rate. We know that because an adverse effect is bradycardia. So that's why you want to have the most important information on the back of your flashcard. You don't want to overwhelm your flashcard with information that's not pertinent or important to whatever is on the other side of your flashcard, because you're going to overwhelm yourself. Also, you want to make sure you use abbreviations, okay? Because like I just said, too many words on the back of your flashcard, it's just gonna confuse you. It's gonna be harder for you to remember what the most important information is for that drug or for that topic. So as you can see on mine, I put HTN for hypertension. That is an abbreviation. Or I use arrows, the up arrow for elevated and the down arrow for decrease, because that's making it shorter for you, because you don't want to overwhelm yourself with all that information. You want to remember the most important information, okay? So this is just an example, and this is why I feel like this flashcards really help with pharmacology, because you really have to remember. Pharmacology is kind of just like, you just got to remember it. That would be my tip for pharmacology, and you can use that with everything. I made flashcards for every subject, not just pharm, but I just wanted to show you guys a quick example of how to make the flashcard and how to put the most important information on the back, so you remember, you know, kind of like what you need for a test. And I just made up that test question. It can be anything, but if you kind of remember those main things about a beta blocker for that example, you should be good on answering a question for a beta blocker. So just make sure you put the most important information on the back of your flashcard. Okay, guys. So I do have a study guide from school, from when I was actually in nursing school, pulled up right here on my laptop. And I'm kind of going to go over some of the things on here with you guys. Like I just said, you can write this stuff for like repetition. It sticks. The flashcards, I always wrote my flashcards out. Like that just helped me. And also you can take your flashcards on the go, which I did plenty of times. I have the topic up here. So this is neuro, okay? And so I just only wrote down two. So the first one is ICP, and the second one says that says Alzheimer's. And I didn't finish writing it because I'm gonna tell you guys. So for the first one, I just have ICP here, and then I have monitor patients for, and then I'll list what are we monitoring our patients for if we're suspecting ICP in these patients. ICP, intracranial pressure. So what are some things that a patient may have if they have some intracranial pressure going on in their brain? What does that mean, first of all? So before you even do a study guide, you need to know the topics that you're talking about. You want to make sure you understand what it is that you're asking yourself. Because just writing something down, yeah, it does help to stick. But if they ask you a question on the test that doesn't just say, what are you monitoring the patients for? It's not just going to say that, right? Because this is critical thinking. It's going to ask you something like your patient comes in and lists all this stuff, and then the answer choices are going to say ICP or a brain, something else. Like they're going to give you all these answers that it sounds like it can be any of them, but it's going to be one, and you're going to know because you're going to understand exactly what this is. So what are we talking about with intracranial pressure? We're talking about increased pressure in the brain, so, you know, maybe due to fluid or a concussion or something, right? Fluid buildup in the brain. So what does that mean? We're going to have pressure in our brain So sometimes that pressure is going to come down on our eyes, right? So we might have some blurred vision. So we're going to want to assess our patient for some blurred vision, right? All that pressure coming down to our frontal lobe. So we might have some headaches going on. So we want to assess our patients for headaches. Also, all that pressure is going to build up. It's going to make our patients nauseous, and they might be throwing up. So nausea, vomiting. What else do we got here? Change strokes, breathing, respirations. Okay, so dilated pinpoint pupils. All of these things are what we're going to be looking for in our patients when we suspect ICP. But knowing how all these things can happen is really important when you're studying, because you don't want to just say, oh, okay, this is what could happen, and I know because I wrote them down. You want to actually understand how these things can be possible from this condition. For Alzheimer's, I have risk factors. I have nursing care, because that's really important when you're taking care of a patient with Alzheimer's. And then we have medications. Also for ICP, I didn't say this, but that would be another topic. So like treatments, medications, what are you going to give? Mannitol probably. So you want to have all these different topics, okay? When you're making a study guide, you want to have your main topic. You want to separate it by system, so neuro, cardiology, however you're going to separate them by system. Don't just toss everything on the study guide. Separate it. It's going to be easier, more organized, so you're going to remember more things. So separate by system and then have different subtitles. So risk factors, symptoms, treatments. You need to have different subtitles so you're getting all the information that they're probably going to ask you on the test, okay? So those are my two examples that I really want to show you guys. So kind of how to format a study guide and then the flashcards. And like I said, you guys are going to have to find out what works best for you. And it can kind of be a trial and error thing in nursing school. And nursing school is spread out depending on if you're going to an accelerated program or a traditional program. It's going to be spread out from 16 months to 2 years. So you kind of have time to figure out what works best for you, but you need to figure out what works best for you. I did study groups. It worked at first, and then it became very social, so I couldn't do study groups anymore. But it did help because you get to kind of feed off of other people. A lot of the people you're going to be in school with are going to have different views on certain things that their views might actually help you to understand something better. So kind of hear the rationale behind something from somebody else. So study groups is helpful. But again, you guys are going to have to find out what works best for you on your own. Just figure out what type of learner you are. If you're a visual learner, like I said before, graphs and videos are going to help you. Depending on whatever type of learner you are, you're going to have to figure out things to do to help you study and focus in and kind of, grasp that information. Registered nurse RN. Oh, God. I'm so bad at this stuff. I'm sorry, guys. But her channel is very helpful, and I used it a lot in nursing school all the time. I would just search a topic like she has, right here she has fetal circulation. She has, I guess the last time I was on here, I was looking at pregnancy stuff. I don't know. She has D-dimer test, DVT. She has it all, and she has it all very organized also by like system. She's somebody who you guys can use as a resource. She explains things, and also find somebody who explains things in a way that you understand. Unfortunately, not all professors are great lecturers, and they might say something that might confuse you more. So you might have to even get a tutor. I had a tutor when I took chemistry because chemistry was really hard for me. I didn't understand it at all, and I was not going to pass the class unless I did tutoring after classes. So if you have to do tutoring, then you need to do tutoring. But make sure you guys are understanding information. And one last thing, don't move on to another topic before understanding the last, because it's just going to come back. And if you don't understand it, then, you're not going to understand it later when it's, part 2 or enhanced. So make sure you guys are understanding information before moving forward. All right, but that's all, guys. That is all I have for tips right now. And the next video I'll make about NCLEX. Again, I'll talk to you guys more about it. Hopefully I can answer some more of your questions. I hope that I gave you guys enough information in this video. I really hope it helps. I wish everybody success on their tests, their exams, their NCLEX. Comment below. Let me know what you guys want to hear next. And thank you guys for watching. Don't forget to subscribe.